So welcome everyone. Thank you guys for coming to our second meeting of winter 2021. And we're gonna start the meeting right now.
Okay, so before we do, I want to go over a couple of disclaimers and rules. So make sure that you guys are muted at all times, especially when the officers and the guest speakers are talking. But worry not, because we have an amazing chat open. So I want to say a lot of positive vibes, guys. Keep commenting your good stuff. And please, when it comes to health professionals that are coming and speaking for us, try not asking diagnostic questions like, hey, I've been having a knee joint pain for this long. I'm sure that they don't want to answer questions about their job when they're off duty. I don't know, maybe. So just don't ask diagnostic questions. Any people that just, I guess, don't abide by the rules, Isabel will cast her wrath, whatever that may be. And just know that this meeting is recorded. So if you guys are not comfortable, then turn your cameras off. But I highly encourage that you guys turn on your cameras. I want to see all your reactions when you hear Christina's inspirational story. And this will be posted on our YouTube channel. So that's that. Next slide.
Okay, so we've implemented this attendance point system as a way for everyone to keep track of meetings that they've attended. And it's also an incentive for everyone to be active club members. So the system works as follows. So in order to earn the full amount of points, which is 3 points, you need to sign in on the Google form at the beginning of the meeting, which you can access through the next slide, sign out on the form at the end of the meeting, and answer the word of the day. And yeah, so that's a total of 3 points. And at the end of the year, the member with the most points will win a prize. And you can also earn additional points if you participate in community service events, such as donating blood at a blood drive or volunteering at your local COVID vaccine site.
So here's the sign in, sign out sheet. You can scan it with your camera on your phone and it'll take you to the Google form. And don't forget, we'll show this again at the end so that you can sign out with the word of the day and get the full 3 points. I'll give everyone a few more seconds.
Okay, so there are a couple events for the future. Obviously today we have Christina, who is a registered nurse, but in a couple of weeks, in February 19th, we have one of Medical Outreach's alumni that are going to speak about her journey to medical school. She's at, I believe, USC's Keck School now. So please come. I think her journey is pretty inspirational too. So yeah. Next slide.
Hey guys, I see your messages about the sign-in sheet, so we'll probably send the form in the chat. But just wanted to let you guys know, if you have been staying updated on the Discord, there are a few more opportunities that you guys can check out. For one thing, there's like the Stanford University Minority Medical Alliance conference, and it does require a small fee, but if you're interested in attending, you can check our Discord about that, as well as several scholarships that have due dates in February if you guys are interested in getting that free money. Any other opportunities you can check out on our website under the spreadsheet or the active opportunities tab.
And here are all of our socials if you want to get connected with us. We have our Instagram, Facebook, YouTube, and our Gmail. And we send out all the updates about events and any other news on our Instagram, Facebook, and our Gmail. And you can sign up for our email list if you haven't already using the QR code on the lower left, and you can like sign up again if you're not sure if you're on it. And all of our meetings are recorded and we put that on our YouTube if you're unable to come to some of our meetings. And we also have all of these posted on our link tree with the QR code on the lower right.
And without further ado, I'll have Christina, our guest speaker today, introduce herself and tell you about her journey to becoming an RN.
All right. Thank you guys for the welcome. Let's see. So I guess, I'll start out with, my name's Christina Ja. I went to Anza as well for my pre-nursing prerequisite classes. I'm a registered nurse. I graduated from Cal State LA, and I've been a nurse for coming up on 2.5 years, almost on to 3. I work at a hospital in Los Angeles in Pasadena called Huntington Hospital on a step-down unit. So step-down meaning it's your intensive care unit is your ICU, which is the most critical unit, and we are the level right below that. So we're pretty high acuity still. We're still working with a lot of patients who are intubated and have an intubation in progress. So yeah, that's a quick welcome. So I guess, how does this work? We're gonna do an interview style, or am I gonna I have the little
definitely.
prompts. Okay. So
yeah, I can ask you questions and then
go ahead. Anyone can ask questions.
Yeah, and then we'll do like a few preliminary questions just so you guys know the basics of Christina's story. And then if you have a question in chat, we'll get them all answered by Christina for sure.
No, that's okay.
So yeah.
I was like, I prepared a little bit, but like not enough because I worked last night.
Oh yeah. No, definitely. Okay. Let me just pull up something.
Okay.
So just tell us about like what it was like going from community college to applying to different nursing programs, and like how was your experience with that?
Just my experience. Okay. So I think just like everyone out of high school, I was kind of confused on what my pathway to, like what my career was going to be. I knew that the medical field really interested me, but at first I thought I started wanting to do pre-med. So I thought I was going to apply to med school and doing all of that. So I started out doing, I believe all the classes are still the same because it was years ago when I was at Anza, but I started doing the general bio series, so the 6 series. I got through to 6B, and then I realized like this is not interesting to me, or this isn't fitting exactly what, I don't know if any of you guys feel the same, but it wasn't fitting for me. So I talked to a counselor there, and we wanted to figure out something within the medical field that I liked. We talked about respiratory therapists, a radiology tech, even dental hygienist. But my counselor suggested to me that nursing seems within the same pathway. You're still in the medical field and working hands-on with the patients. And really, like in the end, you are making like a huge impact on their life, because I guess some distances from my experience in nursing, you're with the patient 12 hours a day. The doctors do come by and make rounds, but they see the patients maybe 5-10 minutes tops because they have so many patients throughout the entire hospital. So just based off of that was something that I really enjoyed. You're with the patient and you hear their stories, you catch assessments, and you catch any sort of like deterioration for the patient, like can decline, and you call the doctor to create a plan so you can like figure out what to do before the patient starts crashing. So that was just a basis of what I liked about nursing, and so I kind of proceeded from there. So from there, that's when I started enrolling in the Bio 40 series, so the anatomy and physiology, and then the intro to OChem. So I know, just talking to a lot of people who are trying to do pre-nursing, those classes are highly impacted, really tough to get into. So from my experience, I was at Anza for 3 years. I know everyone does try to like to get in and out of Anza within 2 years, complete all their prereqs, but I know it's getting more difficult to get into those classes. So it's being pushed back a little bit further, like you're having to do bio, like after you finish all your your GE classes and those sort of things. So then after finally completing all my bio series, which was a long time, it was a tough class. Bio is tough, Gen Chem is tough. We had microbiology as well, was a pretty tough class also. And I know those are really limited classes that were being offered. So after all of that, while doing all the classes, you're also simultaneously applying to all these nursing schools. So I would say that my experience in applying for nursing school was pretty unorganized. I didn't have any friends who were nurses. I didn't know anyone who was kind of going through the same process as me. So I just had to go through like a lot of research on my own. So based off of my experience as well. So there are, public universities, which are the Cal State schools, and then there are your UC schools. So the two schools that offer nursing programs through UC system are UC Irvine and UCLA. Because those are UC schools, those are also very difficult like universities to get into for nursing programs. So I decided to broaden my range and apply to only the Cal States because the Cal States required a different set of prerequisites versus the UC system. So if I decided to go for the UC route, I would only be limited to applying to two schools, whereas when I applied to the Cal States, I was opening the doors to all Cal State universities. And I do think a common misconception is that, the UCs are a better school system. Having gone through Cal State LA, I really enjoyed my experience there. I felt like the program was adequate enough. Our boards, our pass rate was 95%. So they were more than substantial. And I felt like they did a really good job educating us for the 3-year program that I was at. So going back when I was looking and trying to gather all my data for applying to nursing school, I pretty much went to every Cal State's nursing application website, and I found all the nitty-gritty details. So there's a lot of nitty-gritty details, meaning there's a TEAS test, and I don't exactly remember what it stands for, but it's an entrance exam that tests, I believe, all sorts of science. I think it's anatomy, physio, chem, and then it has a math and English portion. And when I was applying, so when I was at Anza, I completed all my prerequisites in 2015, and I transferred out in 2015. I know it sounds like decades ago, it's like dinosaur years, but at that time, the application process needed your T scores, and then of course your GPA. Those are the two biggest things that they weigh upon. And then they also take, some schools take into accord if you speak other languages, and this is not speaking for all schools. Some schools will take a language if you're able to speak, usually mostly Spanish, Chinese, Farsi, or Armenian. And then if you had previous volunteer experiences. So I'm sure you guys know that like volunteering is pretty crucial. It's important to make connections, like whether or not you're in a hospital or in a medical office setting. Just the fact that you're exposing yourself to a healthcare setting is really important. So having hours in a volunteer setting is really, really important as well. What else can I tell you? I believe that was some of the biggest points for applications. San Jose State, I already know, has an exceptional program, so I know that's highly impacted as well. I know their cohorts, they're starting to expand the number because nursing is such a high demand degree, so they're starting to allow more people coming in. So once you have to put together all these paperwork, you have to get copies of your transcripts. You have to get recommendation letters from either prior employers or a teacher or faculty. Then you get all these copies, you put them in a giant envelope, and then you mail it off to whatever school that you're applying to. And then you're just sitting and waiting and being patient and crossing your fingers and be like, anyone, like, please accept me. At that time, I was so nervous because I wasn't sure how strong my GPA was. I did have a 3.73. And then in the end, my T score was a 92%. So those were the stats of what I had when I got into my nursing school. Just to give you guys a rundown too, I applied to, I think, 7 Cal State universities, and I got into 3 being, 4. I got to San Jose State, Sacramento State, Cal State LA, of course, and then Cal State Fresno. I chose LA because I just wanted to experience the life in SoCal. Everyone says it's fun. You got to do it at some point in your life. So yeah, Cal State LA is where I chose, and I'm still here in LA. And I don't know if I ever see myself going back to San Jose, but we'll see.
Wow, that was a really great rundown of the application process. And
Yeah.
yeah, something wish that I knew early on.
Okay.
And
All right.
so during that application process, do you have any tips on how to make your application as strong as possible, like the extracurriculars or any special programs that you did?
Yeah. So definitely, of course, like you said, extracurriculars, participating, for example, in this medical outreach club, that's always really great. Definitely, like I said, volunteering somewhere. If you can, a lot of people who go into pre-nursing want to go into the inpatient setting, meaning um, like, getting involved in a hospital. So for me, I volunteered at Lucille Packard Children's Hospital. So I was volunteering out at Stanford, and I got in just based off of their website. I had some prior work experience, so I think that helped a little bit. Just I was working at a boba shop, so that helped a little bit. Just in terms of communicating with your team members or having some sort of customer service experience. So that definitely helped. They require, I believe, a minimum of 100 hours um, to be considered credit that you could use to apply for nursing school. Because I think anything less than 100 hours, they said that it wasn't, yeah, it didn't count as long enough for you to use that as credit. Other things, I'm trying to think. Like I said, it's been a while, so T-score, GPA, language. I know some schools actually will base your location and give you extra points off of that. So I remember, I believe it was Cal State Northridge. And if you live close within the vicinity, they will give you extra points for that. And I was told that it's like a myth, because I was told that with San Jose State, if you lived in San Jose or you provided an address that was in San Jose, you're more likely to get in. I haven't heard from many friends or people who've experienced that. I think the people who did get in still had strong statistics to get in. Some schools required like a personal statement, so you explaining your reasoning why you want to get into nursing, and just elaborating a little bit more in depth on that. And I think a lot of the times the schools are looking for just like genuinity, looking for like your kindness and compassion and wanting to help patients, because I think a lot of the times currently right now we come across a lot of nurses who have done it just for like a stable job or a paycheck, and you can just tell that the way that they treat their patients are a little bit different than someone who went in it for like the right reasons. So that's something that they look for in an application. But I think that's what else have we had. Oh, of course, if you were a prior veteran or you served in the military, those gave extra points too. And yeah, those were some of the key things. And of course, like, something that benefits is if you had anyone who recently applied to nursing school, definitely like reach out to your friends and ask them, because I'm sure the process is a little bit different than what I went through, but definitely ask your friends, because what better way to get some background as far as applying than having the people who are actually actively applying yourself.
Okay, and someone asked, how did you start organizing the whole application process to nursing schools? Because right now it seems like a big thing to deal with in terms of different requirements for schools, even with CSUs.
Sure. Okay. So I'm a little bit of like an organization freak. So I organized a Google Doc, and that helped me a lot. So I went through like a column and I labeled it, it's each Cal State. And then a lot of the applications I know said that you can only have one class in progress while applying. So some other schools say you can have 2 classes in progress. some schools said that you can't have any classes in progress at all bio series, all chem series, all micro series had to be completed before you even started applying, because like I said, they do need a record of your transcripts. Let's see, that was another column I had. Another column I had was like the deadline to apply, because there were certain deadlines. So each school is different. I wish it was as nice as like a general Cal State application or a UC application where you can submit one application and applies to all schools, but it's not. So definitely do your research early. And I pretty much started like 6 or 7 months in advance before knowing that I was going to finish all my prereqs, because it did take a while to find all the information. And once you find all the information, what I did was I shared it to some of my friends who I knew were also applying, who were a little bit lost in the application process. So we kind of just bounced information back and forth off of each other. And I'm not sure at that time, but because I had some of the same friends who were doing the whole bio and chem and OChem series, I knew that they were applying for nursing schools. So I would share with them and we would kind of feed information off each other and say, oh, did you apply to that school yet? Oh yeah, I heard that this is the deadline for that school. Another thing to keep in mind too is that the application process was fairly expensive, and I know, not everyone has the same financial situations, but each application was roughly like $100 to $150. This accounts for the time that their staff has to take to read through your application, and then of course like mailing it out and then getting copies of your own transcripts. They all had to be official transcripts, which I think is like $5 to $10 for each school. So it does add up, and I think that's something that people forget, is that you have to actually save a lot of money so that you do have enough finances to apply for these applications. Yeah.
And also, did you consider tagging to any schools?
Can you remind me again what tagging means again? I forgot.
Like you submit an application, like a guaranteed application to one school.
Oh,
yeah, it's short for transfer admission guarantee. Yeah.
I remember that term, but I want to say that no nursing programs allowed it that, because it was so highly impacted that, yeah, they didn't allow us to tag to a school.
And also, somebody asked, you applied to the School of Nursing of the CSUs, not from the CSU Apply website?
Yes, I applied to this school from each School of Nursing's website. I'm trying to think. I don't think I remember applying to the CSU Apply. But like I said, the process could be different now, and I wish I had a more recent update, but back when I applied in 2015, I applied to each School of Nursing's website.
Yeah, I think it might be different now, because right now they require to do the general university application through CSU Apply, and then you do the supplemental, which is through NursingCast, like the centralized nursing program application, but that's only for some schools.
I see.
So it's like yeah, you have to pay for the CSU Apply, obviously, and the NursingCast, you also have to pay for that, and that's how the numbers can add up even more.
That's tough.
Yeah, but some of the other supplementals, it's like through their own university, School of Nursing, and that one's like no cost. But yeah, there's a lot of supplementals to keep track of.
Gotcha. Yeah, I think my recommendation is just, be as organized as possible. And I think organization also makes a really good nurse as well, because there's so much going on. So start off being organized, create like a list, deadlines and everything. Like I said, I wish I could give you a little bit more about like the CSU Apply, but I don't recall that being something when I applied a couple years back.
And as for your daily life, how does a week in the life for you in the Stepdown unit look like?
Yeah. Okay, so I'll give you, I guess, just a general gist of what my unit is like. So overall, California is deemed as a state where lots and lots of nurses try to come into. It's so hard if you're a nurse from a different state to come to California, because California has a strict nurse to patient ratio. So in California, our maximum ratio is 5 patients to 1 nurse. On my unit, because we do have really sick patients, my unit's a max of 3 patients to 1 nurse. So based off of California law, we cannot go above that, but I will give you guys a disclaimer that because of COVID right now, our numbers are like still through the roof. So we have been going a little bit out of ratio. But so right now my unit has totally transformed into a COVID unit. And I will admit it's very eerie. It's like we'll have patients, you know, passing like left and right. And you do get, it's hard, but you have to learn how to distance yourself emotionally from these patients, because otherwise the burnout rate is really quick. Because you know, you're with these patients for 12 hours at a day and you develop a relationship with them. And then for them to either like pass unexpectedly or even pass expectedly, it does get very emotionally draining. But the prior to my unit being a COVID unit, we got a wide array of patients. So we did have patients who were what we call have like a tracheostomy. So they do have like a breathing tube in their throat and they're connected to like a breathing vent. Those were some of our really sick patients because we basically required a machine to breathe for you. We worked with a lot of open heart surgery patients. So they'd be patients who have tubes coming out of their chest and they're hooked up to like a suction or a vacuum so that we can either re-expand their lungs or re-expand their heart. We work with a lot of septic patients, meaning they have like infections in their bloodstreams and that can actively attack like any of your organs, meaning you know, they can get sick really, really quickly. So yeah, I would say like my unit is pretty high acuity. You have to be really organized, you have to think quickly, you have to critical think, like predict what could happen or what you would do in the worst case situations. We've had on my unit so many, what we call them code blues, and code blues are situations where your patient either stops breathing or your patient like loses a heartbeat. So that's when, you know, your critical care thinking comes into play. You have to know how to stay calm under pressure because you're doing chest compressions on these patients. We're giving like life-saving medication. So I will not lie and say like nursing is easy. It's quite difficult because you come home from these 12-hour shifts and then you always think like if you had a patient pass, like what could I have done differently? Like could I have saved this patient's life? So there's a pretty big emotional aspect into nursing if you're genuinely interested in like the career. So for me, I work 12-hour shifts and I work the graveyard shift. So I work from 7 p.m. to 7:30 a.m. So that accounts for a 30-minute lunch. I guess your average day is you are getting a report from the off-coming nurse. So there's a day shift and there's a night shift. So you get a report from them. They basically kind of go over the history, what happened with the day today, what doctors are on for this patient. And there's medications you have to give. You know, you do have to do like the nitty gritty dirty stuff. You are cleaning bowel movements, we're cleaning urine, we're doing all the care for the patients, especially if they're not able to do it for themselves. What else? A lot of the times it is a lot of you're following orders from a doctor. So the doctor kind of puts together the care plan. As the nurse, you are giving input, but in the end, the final say is the doctor. So you kind of just coordinate with them. My hospital is a teaching hospital, meaning that we have residents, kind of like similar how Grey's Anatomy is, but we do have residents that are in our hospital that they're open to suggestions because they're learning just as we're learning. We don't work with the attendings that often, we work with more of the residents. And then, yeah, you formulate like a plan together. You you work with your team members and you hopefully get through that 12 hours pretty smoothly. So I work, like I said, the 312s. On my off days, it's a lot of recovering from like lack of sleep or like tiredness. It'll take me probably like a day to feel lively again, to even get myself a chance to even do any sort of errands. I've been, during this COVID times, because we've been short staffed, I've been picking up extra shifts. So I've been working maybe 4 to 5 shifts a week. So maybe that's like 60 hours a week. So it does get pretty draining. You just have to make sure you set time aside for yourself and have some sort of way to relieve your stress, because like I said, the burnout rate is pretty high.
Wow, that's a lot in a week, and a
Yeah, it's a
regular
lot.
week is like 40 hours.
Yeah, that's your regular week for sure.
So did you always know that you wanted to work in the step-down unit when you graduated, or like how do you decide which hospital or department you're going to work at?
Sure. So during nursing school, I kind of similar to the nursing school application process, I knew that getting a job as a registered nurse was also very impacted and very difficult. So while I was actually in nursing school, I applied to work as a nurse's aide. So I worked as a nurse's aide once a week. So that helped me get my foot in the door at a hospital. So the unit I worked on as a nurse's aide is where I ended up getting hired on as, because same thing, I knew the manager, I knew like all the staff that I worked with. So all the nurses that I worked with knew that I was a good worker as a nurse's aide. So I got a lot of good letter of references from them for the interview, and they were on my interview panel, so I already felt comfortable with them, which was definitely very helpful. Because in the end, I will admit it was one of 2 job offers I got, and it's pretty impacted, not gonna lie. There's a lot of there's a whole bunch of nursing schools now. They're rolling out, of course, a lot of new potential nurses. So it's tough to get a job in a inpatient setting, so in the hospital setting. So that's how I ended up on my unit. I do like the acuity of my unit, though. It's a mixture of really sick patients, a little bit of some who I don't have to stress out so much about. So it's a good balance of both.
There's someone in the chat who asks
Yeah.
what a nurse's aide is.
Okay. Yeah, I think there was a couple of other questions too. I don't know if I could read through all of them. Okay. Somebody asked earlier too, how did you start? Okay. You were heading. How many hours do you think is good? Is a recommendation letter from a past employer or teacher better? This was from a Kim. Just for me, I think this was back when I was talking about volunteering. I was saying that 100 hours is good, and then either a recommendation letter from, I would say probably an employer, because they know your work ethic a little bit better than a teacher is better than, employer is better than a teacher. So that's that. I think I answered the favorite part. Even applied nursing school website. Nursing school is expensive. Was there anything else? Okay, so going back. So a nursing aide is you are not licensed, you're certified. So for me, when I was in nursing school, I completed it's called a CNA course, meaning a certified nursing assistant course. You basically help the registered nurses with any, any non-medical care, meaning you can help with hygiene. So you do like bathing and cleaning and turning patients. You take care of, any kind of basically anything that doesn't require medical experience. So I can feed the patients, I can give them water, I can clean them, I can bathe them, I can walk them. And like I said, that's really helpful because you develop relationships with your nurses and then your managers as well. Nursing is the same as, yes, a nursing aide is the same as a CNA, but I will also give you a note that you don't necessarily have to be certified as a CNA to work as a nurse's aide. And I guess that gets a little bit confusing because it depends on your hospital. So at the hospital that I worked for as a nursing aide, I just needed to be enrolled in a nursing program in order to work, because I think how that hospital views it is that you already already know some of the basics from nursing school, and then you can apply that to nursing aid. So they just needed a transcript that you're enrolled in nursing school in order to work as a CNA.
So, in that case, did you do the same things as a CNA would as a nursing aide?
Yes, I did. It's essentially the same thing.
Oh, because like yeah, I know like CNA courses, they can be really expensive and they run out for like a few months at minimum. And I
Right.
didn't know that as a nursing aide, you could just not be certified and you could just be enrolled in a nursing program.
Yeah, like I said, it's important to read into like the hospital that you're applying for, because my hospital in particular didn't require you to be certified. They just needed the nursing school transcripts. The only thing I would suggest is that if you really wanted to start early, then maybe if financially possible, to do the certified nursing assistant course so that you could start getting just like your patient care experience before even applying to nursing school, because I guess it could take a little while to get your transcripts from your nursing school to start applying to hospitals. So either way works, and I guess my recommendation would be like the earlier the better. I think some people may also argue and say like you don't necessarily need to have the nursing aid experience um, to get a job like as an RN afterwards. But for me, I think I would recommend it because it gets yourself a little bit more comfortable with patients and just like talking to them and just managing like if they're on oxygen, like making sure you're feeling comfortable with what handling patients who are even on oxygen or on these breathing machines. And I know it can be a little bit daunting if you're new at first, but I like the fact that I could expose myself to these patients that would initially make me a little bit nervous.
So when you're applying for a job, do the hospital just put you in whichever unit that they need?
Yeah, I think when I was applying for a job, it was um, wherever I could get a job. I wasn't too picky at that in the beginning. Usually, if a hospital is really good about it, they will, if you feel like the unit is not for you. So, for example, let's say I got hired initially on a unit that I wasn't too huge a fan on. I would work that unit for maybe like a year, and then you can talk to your manager, and hopefully they can try to get you to a unit that you like. A hospital, if you work at a good hospital, they should all be about like your growth and finding you someplace that you thrive in.
So, being on a step down unit when there's lots of stress and working that 60 hours a week schedule, do you get time to like do your own hobbies on the side or like, yeah.
Yeah. Yes and no. I think when I do decide to take up the extra shifts when I'm working like 60 hours a week, I don't, because I think I only have like 2 days off, and then I'll decide to just either sleep in like the whole day or and then my other day will be like to run errands so I can like cook so that I can have meals and everything for the rest of my shifts. But if I do just work my normal like 40 hours a week, I will have a pretty good life balance. And I think that was a question somebody asked earlier as well, is that life balance is so important, I think, for me, because once again, working in these high stress jobs, your mental health and I think like any sort of emotions can really take a toll from it. Let's say pre-COVID, I was a lot better at finding outlets to kind of take my stress away from work. Right now, I guess with COVID, it's really hard with everything closed down and nothing being open. So I'm finding things at home to kind of entertain myself with. But for the most part, I would say if I work just my 40 hours a week, I'd have a pretty good balance. I had a lot of friends from nursing school who became nurses. So we would kind of coordinate our schedules so that we had the same days off, because a lot of the times, like our friends who work Monday through Friday jobs, they obviously weren't able to do things with us on the weekdays. So yeah, I think it felt pretty healthy. And I think it's up to the nurse themselves to make time for themselves, because no one's gonna always be on you to make sure that your stress is well taken care of.
And in the pre-COVID, with that schedule too, were you able to have time to like travel?
Oh yeah, I love traveling. That was one of my big outlets. I was traveling, so once again, depending on the hospital, but we were allowed 2 weeks of vacation time a year. So you can take 2 weeks and you could split it up whenever. With being a nurse, I love the schedule flexibility, because you're only required to work 3 hours, 3 to 4 shifts a week, allowing you 3 days off. So if I were to plan it pretty strategically, sometimes I could get 7 days off without even using like vacation hours. So that was really nice. That's actually probably one of my favorite things about being a nurse, is like the schedule flexibility.
And when you were in nursing school, you were probably in like clinicals and stuff. So was that transition from being in clinicals to actually working as in a job like big difference?
Yeah, being a nurse now, and sometimes even having nursing students at my hospital, I feel like nursing school almost doesn't give you the full picture of what being a nurse is like, because I think, of course, nursing school, they have to meet certain requirements from, I believe, like the Board of Registered Nurses. Like you have to go through certain curriculum and criterias. But you realize, like, when you actually start your job as being a nurse, it's so much different than nursing school, because there are some details that you have to push aside and be like, this is not important right now. We have to take a look at a bigger picture of the patient and figure out like this is what matters for the patient. So with when I was in nursing school during clinicals, I felt like some of the nurses that I was partnered with weren't allowing me to be as hands-on. And I understand that, because in the end, it's the registered nurse's license as risk. But when I have students now, I'll try my best to have them as hands-on as possible. I'll still watch them and make sure like they're doing everything safely, but I'm having them do everything because I want them to get a real experience of how it's like when they're actually a nurse, because they do have to call doctors. I know sometimes that can seem scary, because um, you're making recommendations to the doctor, you're asking them for things, but you get a little bit more comfortable with it at time. But in a sense, I would say that nursing school didn't really give me a good picture of what being a nurse was like.
And with that, did you consider any other career options like NP or PA or an MD?
Yeah, so when I started out doing my prereqs, I considered like pursuing like MMD. That idea quickly disagreed. I then, now that I'm hitting my 3 years into nursing, I'm considering going back for school. So now I'm probably going to go back to school for my master's in nursing. So I'm interested in potentially being an NP, or getting my master's in education, which would further allow me to either like be a teacher at a school, or I can teach new nurses at hospitals. Like, I guess the basics are how to be a nurse. The most schools require 2 years to 2 years of bedside experience, or 2 years of nursing experience before you can apply to be an NP. So just to clarify too, there are different types of NPs. I think that's something I didn't know when I was in nursing school. So there's like a family nurse practitioner, which means that you usually work in a clinical setting, but you're seeing patients, like relatively healthy patients who are in the community that usually have, let's say, usually like diabetes or hypertension. And as a family nurse practitioner, then you can prescribe patients' medications, like diabetes medications or like blood pressure medications. But when you're in an inpatient setting, because there's an acute care NP, those are more like you're working more with interdisciplines. You're working with a cardiologist or you're working with a pulmonologist. So that's a little bit, the acute care NP is a little bit more difficult of a program to get into. So yeah, so those are some of the ideas that I have. I haven't quite started applying yet, but that's something that I'm planning to lean on to doing soon.
And for just a clarification, can you differentiate like the difference between like a PA and an NP?
Uh-huh. So I just had a friend who graduated from PA school, so this is probably how I know so much about being a PA, but essentially she and I spoke and she said that as a PA, you're almost exactly doing the same things as an NP because she's my friend who's a PA, she's actually applying to NP jobs. To be honest, I don't know the exact difference, but I know that the roles and responsibilities are pretty much the same. I believe with PAs, you're given the opportunity to assist during surgeries, and NPs, I don't believe you are, depending on the type of NP you are. But their roles are very similar. I think the difference may be schooling. With PA programs, there's not as many PA programs, and I believe the schooling requires, let's see, 2 to 3 years after you complete your bachelor's and take your GRE courses. Whereas with nursing, it's between a 2 to 3 year program for your bachelor's, and you can practice for nursing with the 2 or 3 years of your bachelor's, and then another 2-year program for your NP school.
And
But
going
like I
back
said,
to, yeah.
oh, go ahead. I
Yeah,
was just
sorry,
saying, like,
go
as far
ahead.
as the technicalities, I'm not 100% sure the difference between like a PA and NPs, because when I work with them in the hospital, the PAs, NPs, they essentially do the same thing for me.
Oh, okay. Yeah, that's
Yeah.
still good insight because I wasn't really sure what the difference was either between the two in terms of what they do.
Sure.
And like going back to your nursing school, what was like the hardest part of it, and like how'd you spend your time at the CSU LA that you transferred to?
Okay. So nursing school, the hardest thing for me was definitely studying. I wasn't blessed like many others to be like naturally smart. I think I had to dedicate a lot more hours studying than some people were like naturally gifted had to. So studying took quite a bit of time. As you know, like in college, so many your class or your grades are based off of your exams. So I think in nursing school, I had 2 exams and maybe like an essay, and that was how my grades were based off of. So the exams were really important. So I always feel like really anxious before like an exam or something. And then I think what else? Just also like the life work balance, because give me a little bit of like a little personal side. I had moved away from home, so I was still adjusting to like making friends and then kind of exploring a new town, and then also trying to do well in school and then make connections like at school with faculty and staff. So that was, to be honest, like that was like a little bit more of the most stressful side for me, was trying to create like a circle here, and yeah, just like people that I could rely on. But studying, of course, was definitely something that took up so much of my time. And then of course clinicals as well. So you were required at my school to have a car, because sometimes some of the clinicals were like 30 or 40 minutes away from where I lived. Let's see what else. Yeah, so then we'd be driving 30 or 40 minutes to our clinicals, and we would stay there for like 12 hours and then have to like drive back. So that was busy too. Aside from that, it wasn't I loved my nursing school experience. I met a lot of lifelong friends in nursing school. They always say like you bond over pain, and that was very true because we were suffering all the time during nursing school. So I've made really good friends throughout nursing school. Um, I've still kept in contact with some of my faculty members because they've stated like if I wanted to come back and teach, they'd be open to that. They would like write a letter of recommendation for me. So I enjoyed my experience during nursing school a lot, and I felt like it was overall like very positive.
Oh, it's really different because I hear a lot of things about how it was like the worst thing ever, and it was very hard to do work-life balance with all of that.
Yeah, I've heard that from some of my classmates as well. Some of my classmates, some of them had their own children, like our age range. So for me, I'll give you just like a brief idea of my cohort was like in nursing school. We were 60 people, so my cohort was 60 max. We lost 5 students throughout the 3 years of nursing school. Either due to like personal life issues or they weren't passing some classes. And then from there, I think we had like maybe like 45 females and like 10 males. I think that was a good ratio. That's why a lot of the guys went to nursing because they were like, oh, we're gonna go into a career with all the ladies. And then let's see, yeah, so that was like a little dynamic. And then a lot of our classmates were single parents too. So I was like, that's so tough. How can they do that all the time? So it just depends on what's going on in your personal life as well, and just how you handle stress, like what your studying habits are. So definitely like be aware of what your personal life studying habits and like I said, how you handle stress before you go into nursing school. And I think if you plan accordingly, it's very manageable is what I'm saying. It wasn't easy, but it was definitely like very manageable.
And do you have any pro tips for community college students or things that you wish that you did differently?
Let's see, as a community college student, definitely just doing more research beforehand because, for example, when I stated my application process was a whole bunch of just like spending so much time doing research and having to put together all this information so that it's clear and organized. I think that's something I would have done differently is just being organized and like staying ahead of the game. Um, I also want to give like just a note that like just when I was in community college, I was very confused and I felt very pressured to like try to get out in 2 years. And I felt like guilty that I didn't know what I wanted to do with my life. I guess my note is just like, take your time, like don't feel pressured to get into something that either your parents are telling you to do or your friends are all doing just because they think it's cool or like because of a paycheck or something. Just do it. Take your time. Like life it's crazy, but I urge people to not do something that they don't feel like they want to do. So I knew that like I wanted to get into nursing, and I think when I look back on it, like I definitely wouldn't have chosen anything different.
And someone to ask, outside of working in hospitals or returning to universities to teach, are there any other jobs that NPs or RNs can take if they wanted to leave the healthcare industry?
Yeah, that's a good question. What is so great, and I think why so many people go into nursing is that it has so much flexibility in the sense like there's many different avenues you can go into. I'll start off with an example. So most people think of nursing being like you work in a hospital or you work like in a clinic setting where you like go to your annual checkups and like the nurse like either gives you your flu shot or like takes your vital signs. But it's so much more than that. It's let's see, I have a lot of friends. I actually also have a second job too, but I have a lot of friends who work 2 jobs. So I have some friends who got into like fertility nursing, which is really cool because they help women who are either infertile, they're doing like IVF treatments. So that's one avenue. I have also friends who do like cosmetic nursing. So they do like laser treatments, like Botox injections. That's also, so there's so many different avenues. There's, what else can you get into? Like case management, meaning you still work in a hospital, but you're coordinating the care for a patient once they leave the hospital. So how insurance covers, like how they're going to get to the facility, how they, I don't know, how they're, like I said, their family that are involved, they bring in all the factors into there. So there's so many things you can do with nursing. And right now I'm still kind of exploring what you can do, but you just talk to people, you kind of figure out like, oh, I'm thinking of exploring different avenues in nursing. What else can you offer? There's a lot of nursing jobs that you can even work from home, doing like telehealth, triage screening. So you're calling someone and say like, hey, like what symptoms are you feeling? Like, okay, because of this, I feel like you should probably go to your local ER for something.
And with some of those different avenues that you just mentioned, are you able to work in those as a new grad, or is there additional schooling for some of them?
It depends on the organization. You can apply to them as new grads if you feel like the inpatient hospital may not be for you, and usually they will train you accordingly. I think a common thing that most people say is that it's always good to try the inpatient and hospital setting just to like determine that either you like it or you don't like it. Because a lot of times if you graduate from nursing school and then you don't try the inpatient setting, then you could lose everything that you've learned, like your critical thinking skills. And then if you wanted to go back into that, it's hard to go back into an inpatient setting because employers will see that you weren't using those critical thinking skills for these years.
Going back to your undergrad, what was some of the favorite highlights during your time at De Anza?
Let's see. At De Anza, what did I do? I had a pretty good work-life balance too. I played a lot of sports at De Anza, so it was a little bit hard balancing like studying and then also like traveling for sports. We had a lot of friends doing sports at De Anza. What else did I do? I don't know. I felt like I didn't really have much of a life like at De Anza, to be honest. It was a lot of study and then sports. Like I said, it's really important to have a good study group. I like to study in groups because I like to kind of like talk my ideas off of each other. But yeah, studying groups was nice because that was also like my social circle, and that like yeah was my way to interact with human beings and not a textbook all the time. Yeah.
And are there any misconceptions or myths about nursing, about like what the reality is actually like?
Let's see. I'll give one. I think one that I'll state is that I think I came into nursing out of nursing school thinking it was going to be rainbows and butterflies. Like patients would be so grateful for everything you do, because I knew I was in there for the right reasons. I'll tell you, it's not always the case. You'll come across patients who, for example, are like drug seekers, like narcotic seekers, and for obvious reasons, the provider won't prescribe them any narcotics. So I've gotten feces thrown at me. I've gotten like urine thrown at me. I've gotten cussed out. Like I've cried in the bathroom after work sometimes. So it's not as glorified as I think, some people may make it out to seem. But in the end, I still think it's worth it. Despite everything I told you, I do think it's worth it. I feel like for the patients who are grateful for you and for the ones who actually like understand like what you're doing, they're very appreciative and they make you feel like you're actually doing something in your lives, which I think is the reason like why I went to it in the first place. Yeah, as you can tell, like I'm pretty like emotionally attached to like my job a little bit. Some people, on the other hand, they just, which is okay. They go in there, they do a great job at their job, and then they leave work. They leave work at work, and then they leave their personal life at home. So that's something that took a little bit of adjusting, because I kept pushing, like, why are my patients, some of them, like, displeased with the care I'm giving them. So I've been working on it. I think I'm learning to kind of also separate the work and life balance too.
And what was like the worst day you've had, and like how'd you deal with that?
The worst day. The worst day I've had was when I had a patient unexpectedly pass on me, where we activated the whole emergency system. We were doing chest compressions, and I think we were doing chest compressions maybe for like 30 or 40 minutes. And this is at the time when family was still allowed, like, in the hospital. So it was the husband and the wife was the patient, and the husband was there, and it was just just such a traumatizing moment to see, like, all these people, like, it like trying to resuscitate your wife. And it just, like, brought me to tears, because he cried and he was so devastated, because she was just in there for a minor procedure. That was so tough to, like, just talk to him about, like, the passing of his wife. And then the thing is, at this point the patient has passed, but for me as a nurse, my job is to continue and progress with what are we doing next. So immediately I feel like I can't even give them the emotional support that they need, because I have to go, okay, like, our policy is a patient who has expired or deceased can't be staying in that room for more than an hour. So automatically we're, like, cleaning her up, we're putting her into a body bag. We have to figure out what mortuary to go into, like, if they want an autopsy to be done. So there's a whole bunch of, like, clinical aspects to it that I think gets left out too. So that was probably, like, one of my toughest days, because that, like, hit me emotionally, and I felt like really like, it really, like, broke my heart to see that. The way you cope with it is really, like, a lot of just talking it out with your coworkers, because, like I mentioned before, like, the pain, like, brings you closer. So you're working through all these really tough situations, and you just talk it out with your coworkers, because I'm sure a lot of times they feel the same way as well.
Wow, I can't imagine that. Like, I think it's really great how nurses like deal with like the sad part of it, because
Yeah.
I feel like not a lot of people think about that. They always think about like, oh, the way they help them and the like positive side of it.
Mm-hmm.
And
Yeah, it's different, definitely different. And I think that's also the difference between, like, doctors and nurses as well, just in case, like, anyone's thinking about it. And so much, like, accolades to doctors, because they do so much. But for example, in that situation, after the patient was pronounced deceased and expired, they had to go do something else. And we, as, like, the nurses, it's our job to kind of, like, comfort the patients, or comfort the family members of the patients. And you're really by their side, and I do think you're giving them a lot of emotional support, versus, like, what like, a doctor who has so many patients to go see, like, really can do.
And previously you mentioned that you've seen nurses working 2 jobs or side jobs. Is this because nursing wages aren't livable, or is there just more time that could be used more productively?
Good question. And so I'll give you my example. I do work 2 jobs too. I would say it's a little bit of both. Everybody likes a little bit more money. So I picked up the extra job because I wanted just a little bit more extra spending money. The wages are livable. I'll give you some of my numbers. I don't mind sharing them, but for me right now, I make in something, like, I know it's very different because I'm in Southern California. Northern California definitely pays a lot higher. I just got some friends who got hired at Stanford, and they told me their wages. So right now I work but I work for the 12-hour shifts and I get paid $38 an hour. And then for me, anything considered over 8 hours is time and a half. So then I do make a little bit more for the extra 4 hours that I work. So in the end, so let's say minus, taxes is a big deal. So I lose a lot from taxes, and then I put some into my retirement after. But in the end, I take home about 2,200 bi-weekly. So that's every 2 weeks. It's definitely livable. If you you kind of learn how to like budget your money, depending on what's going on in your life too. If you're saving for like a house or something, I think for me, like that's my next big plan, is saving for a house. So I try to save a good amount of money and put it aside for a house. And I do think if you do have like a little bit more of a different lifestyle, maybe the wages may not be like as livable, or you maybe just not saving up as more. I definitely think nursing pays a decent amount, and you can get by definitely working just one job. Yeah.
Thank you so much for all your insight. If anyone has any more questions, please drop them in the chat. And I actually want to ask you a question. No, it's okay. I actually have a question for you. You mentioned that how your step-down unit has kind of transitioned into a COVID unit now.
Mm-hmm.
So how do you cope with that like 60-hour work week?
Yeah. Once again, it's right now, like I think in the emotional state, like I could be doing definitely better. I know it's just temporary, like what's going on with COVID right now. So I'm just looking, I get the light at the end of the tunnel. Our numbers are stabilizing. So for me, that's good, because before we were increasing in the numbers, we were running out of beds in my hospital. It was so crazy. We were using our lecture halls as spaces to put patients. So they were just tarps up like from the ceiling down, and it looked so like out of a movie. But it was pretty crazy at a point in time. Right now, like our numbers are stabilizing. I want to say like it's hopefully from like the vaccine and just people still like socially distancing and being responsible for that. Coping wise, I don't know. I think I could be doing better, but I think just once again, just talking to your coworkers and just letting that be like an outlet for you, for sure.
Christina, if you'd like to take like a little break, or if you want to like take some time, we can offer that. I know.
Oh yeah, I think I just have something in my eye. I think that's my biggest thing. So give me 1 second.
Yeah.
Yeah, so if you guys have any more last minute questions, definitely drop them in the chat. This is the time to do it now. We want to be sensitive to everyone's time. The official end is 2:30. So just if you have less thoughts, drop them in the chat.
Christina, I just wanted to thank you, because I know it's like pretty tough right now. And like you were telling me about your 60 hours a week. And I cannot imagine how much that is on one person. And I also want to like work in the health as well. And just listening from your perspective and dealing with COVID, it's just amazing how you're able to do all that. And I don't know, I just think I have a lot of respect for you, and I want to thank you for working so hard and taking those extra shifts. I'm sure it's like really challenging right now.
Oh, well, thank you so much. I appreciate that. It's definitely tough, but hopefully, like I said, we're remaining optimistic, and we're knowing like there is going to be like an end to this. So thank you so much for saying that. I really appreciate it.
Yeah, thank you. So like, seriously, I'm so amazed by how you're managing all this, because just school alone, for me, it's like, wow, it's a lot. But people who are actually working at a hospital, it must be like 10 times harder just to do all that. So thank you.
Of course. Thank you guys for having me, of course, too. let's see, I think I see. So if I'm following the path to NP, is learning if it'll be right to pursue PhD or doctor. I'm not like 100% from like super confident with my knowledge about a DNP, but the DNP I know you're doing a lot of research, so um you're doing a lot of research for like medicine, and because you are a doctor in the end. I don't work a lot with doctors of nursing practice, so I can't really say as well. But the friends that I know who do pursue doctors of practice are ones who want to get into research and to want to formulate um, like new studies, and who want to create some sort of new plan for patients who are having like a disease that isn't manageable. Yeah, I don't know, is that it?
Yeah, I think that's it. There's no more questions in the chat or, oh. Yeah, if there's nothing else, then thank you so much, Christina. We really, really appreciate squeezing us into your really busy schedule. And I think this has been such a learning experience for all of us, those who are also aspiring to be a nurse or a nurse practitioner. I think they really also appreciate it as well.
No
I hope you
problem.
get
I'm so
sleep.
glad. Oh, thank you.
Yes.
I'm probably gonna
Get a
sleep
lot
after
of
this.
sleep.
I really hope you get sleep.
All right, no problem. Thank you.
But yeah, thank you again, once again. And then see you next time.
Thank you.
Bye, guys.
Bye, everyone.